Hello. Welcome to day 2 of the Schiller Institute Conference. What we're going to do now is we're going to resume our panel, and I think people will have quite a bit to say when we come back. And I'm going to actually take up from something from Dr. Vitrenko sort of indicated, the need for a worldwide movement on behalf of human progress and a new human civilization. Helga Zepp-LaRouche had called a few months ago for something called the Committee for the Coincidence of Opposites, and this was the idea of a completely new world health platform to address the pandemic that was clearly already sweeping the world, but was itself only the harbinger of a horrible and terrifying future, which might wipe us out before a thermonuclear war. But there was another element to what she was concerned about, seeing the social unrest in the United States and actually throughout the world. Social unrest, largely legitimate in part because of poverty and because of racism and other things. The problem was, how could we actually address that from the Schiller Institute's standpoint? Some of you know that the Schiller Institute's vice president was Amelia Boynton Robinson of Tuskegee, Alabama, and Selma, Alabama. She was the vice president of the Schiller Institute for 25 years. And she was the woman that brought the Reverend Dr. Martin Luther King to Selma, Alabama originally back in 1963, and was beaten and left for dead on the Edmund Pettus Bridge. The idea of revolutionary, creative, nonviolent, direct action is something that Helga had also embraced back in 1992 at a time when Lyndon LaRouche was in prison and the Reverend James Bevel ran as vice president on Lyndon LaRouche's behalf because Lynn was in jail at that time. The idea of fighting as a partisan for the truth is something that has been a certain kind of American tradition, as it is also around the world. And so what the idea has been is to actually think about how you bring together people who have different political outlooks or different views in various other ways when you're faced with something which may be an existential threat to humanity as a whole. And so to speak about that, first we're going to hear from Dr. Joycelyn Elders, former Surgeon General of the United States from 1994-95.
Thank you so much for this opportunity to address the Schiller Institute conferences. The conference today is to address a new paradigm united toward the common aims of humankind. In a whirlwind of disasters, we've been barraged by a worldwide pandemic of the new virus, medical unpreparedness, shortage of PPEs, hospital space, and medical personnel, government unpreparedness, economic recessions, unemployment, huge numbers of hungry, helpless, and hungry people, and police brutality. We're witnessing disparities in the US and around the world that we have tried for many years to wish away. We won't be forgetting 2020 anytime soon. It's as though all trauma from the diseases surrounding us and almost consuming us have torn away the shackles from our eyes, and now we see with 2020 vision. How did we not see these disasters coming? With huge numbers of people are dissatisfied with disparities and inequities that are now seen with 2020 vision in all areas of economics, social justice, and medicine. Whole countries have essentially shut down. The world's people are on hold. Now, all of those people on hold are wondering, what do we do in this new world? So what can we do? We've done the groundwork already. When we look at all areas of economics, social justice, and medicine, all aspects of a person's life, and labeled it the social determinants of health. We know that a person's health is more than just a germ or injured organ. Rather, health is determined by an interconnected system of all that is in a society. We know that the social determinants of health are facts rather than a political stance. We've not trained our people about the difference in belief and fact. Many do not seem to understand the importance of public health and welfare. A person is only as healthy as the least healthy and wealthy person. Healthcare and wealth must be extended to everyone for public health to be good. Every person in humankind needs the same things to be whole and healthy. The social determinants of health addresses these needs. Of course, we must address the pandemic of COVID-19 that is killing people all over the world. We've applied procedures and principles developed over centuries, and we know what to do about this infection. Discovering that it is airborne, we know to wear masks, to distance ourselves physically from others, to not gather in groups, to stay at home, to use Zoom. We are in the process of developing better tests and vaccines and are slowly learning about treatments and existing medications that are effective in treating COVID-19. This is a short-term solution to the immediate problem, that the anxiety we feel is from more than COVID-19. Most of us realize the disparities and inequities cost lives, that we're only as healthy as our least healthy person. Those who have money are just as vulnerable as those who have not. The higher caste are just as sick as the lower caste. We must change our health system, and to do so involves changing our social system. But is this the right time to tackle a huge change in the middle of a pandemic? Medical science can offer, and I think we like to offer, better health and welfare systems to the world. We already know what needs to be done. The how to accomplish this is still waiting. And many seem to be thinking about how to accomplish a great change. After education, we must decide what to do next. We know our goal, the great change of our society to make the social determinants of health a realization for all. I think we all want to turn to developing public health systems. There will be armies for equitable health and welfare. We need whole armies to bring about these changes. Helga LaRouche has called for the formation of the Committee for the Coincidence of Opposites. This initiative will establish an international course to advocate the creation of a kind of Apollo project in world health care, as sudden yet inspiring as was John F. Kennedy's Impossible Moon Project. It isn't as though we're proposing something new as new public health workers. We're abundant and we're found in the future in much of the United States back in the 1860s. We're proposing that young people worldwide, from high school, college, and post-college age groups, be incorporated into an international health extension service that supplements the inadequately staffed medical needs of governments worldwide. As I said at an earlier Schiller Institute conference, when the idea of the committee was first proposed by Helga, you have tiers of people from the community, healthcare workers, to their intermediate supervisors, to people with some medical education, all the way up to nursing assistants, nurse practitioners, doctors, and right up to the highest level of super specialist neurosurgeons. We often do too much specialized care and we do not do enough basic public health care to improve the health of our nation. A public health workforce would do far more to maintain our health than 100 surgeons. Public health workers and these public health care systems are not doctors or nurses. Giving out masks, taking temperatures, and even contact tracing and some diagnostics does not require one to have a medical degree or to go to school for 12 years. This would be a public health corps that could be interfaced with the Army Corps of Engineers and many other agencies throughout our government. We need millions of public health workers in the United States, and the world needs tens of millions. This is one of the most efficient economic investments that can be made anywhere in the world, especially when millions are out of work. Public health systems in each country connected into a global public healthcare system could achieve better healthcare and better welfare than hundreds of millions of people. The Organization of African Unity has devised plans to tackle many aspects of a continent-wide health plan. Ethiopia and many other nations have successfully created a large number of community health workers and have developed entire curricula on teaching community how to teach community health workers. Much has been tested. The global concern for one another could be the beginning of a public healthcare system, because that is what public health does, care for one another's welfare. To survive this and future pandemics, we need to secure the freedom of health to all people everywhere in the world. We need to all work together, no matter how opposite we are from all over the world. It's a tall order, but disparities in health, education, housing, work, and social errors must be not only addressed, but eliminated. Equity can be the word for 2020. We're striving towards an equitable world. Today's world health situation may be fearful, but need not be our fate. To say otherwise is to speak falsely and with fear. The world can turn from the course of division long enough to save tens of millions from death. To survive the surely oncoming pandemics, we need to secure the freedom of health to all people everywhere in the world. We need to all work together, no matter how opposite we are, from all over the world. That is what we mean by a coincidence of opposites, higher alliance, based on the principles of malice toward no one and charity toward all. That can ensure our durable survival and health as a human race. Perhaps in the future, children will study the world watershed year of 2020 and see that the outstanding event was not the pandemic and ensuing disasters, but the world began to change into a better place for humankind. We must be the leaders. In order to be the leaders, we must learn what the community needs to make sure that we understand what's going on so we can provide them for what must be provided. We've got to educate and empower all of the people and educate and empower our youth so that we can all be involved and we can all be planned to do what we need to do to make a difference. We have to have what I call determined boldness to go out and meet the problems where they are, tackle them where they are, and do what we need to do to make a difference. We can do this, we know how, and we must get started. Thank you.
Thank you, Dr. Elders. There's no better way to get an actual idea of the health conditions facing America than to go and look at what is happening in the state of Mississippi, as the artist Nina Simone noted famously many decades ago. Representative Jim Evans represented the 70th District of the Mississippi State Legislature for 25 years until the year 2016, and he could not be with us live, but we've prepared a short statement from him.
I was community engagement coordinator for the AFL-CIO, a member of the House of Representatives, president of the Jackson Advocate, president of the Southern Christian Leadership Conference, and founder president of the Immigrant Rights Alliance and others. But I began to retire from all of those, but I can't retire from the Mississippi Immigrant Rights Alliance because the abuse that they're receiving is just too great for me to leave. In good conscience, I can't retire till we do something about the maddening, sickening, disgusting, inhumane immigration situation we have in America. It is absolutely atrocious. In Mississippi, we've always been really concerned about the social disparities in healthcare and how those economic disparities affect that. In Mississippi, we often say that we have a three-way pandemic all the time going here: the pandemic of racism, the pandemic of poverty, and the pandemic of violence. And when you add the pandemic of COVID-19 to this, we got a four-way pandemic. That means we're boxed in, and it's time now for everybody to get up. So we have to deal with the social disparities of healthcare. Well, Dr. Robert Smith was the civil rights doctor, so when folks got beaten in the head and cut and kicked around and left for dead, he was the person that brought you back to health, and he always did it for folks in the movement free of charge. And he's still the doctor for Tougaloo in Jackson State, and he runs the healthcare center here in Mississippi, which is now part of Merit Healthcare Center. But Dr. Robert Smith is really, we call him Black Moses. He is the number one person. He does more to deal with the disparities of healthcare in Mississippi than anybody that's ever been here. So all of his life, his whole practice has been part of it. But he was tending the wounds of Meg Evers and back in the early 60s and all the folks around him. He's been part of it all of his life. Still there practicing medicine and still making house calls. The last report that I did in the legislation, you said 2030. I'm telling you, in the last 5 years, I did this report 5 years ago where I laid out how many hospitals would close down and where they would be because we was not expanding Medicare, and the hospitals have to provide energy of care, and now there was no way for them to get paid for it. And I predicted that 23 hospitals in strategic areas would close down, and all of them have been closed. And we have other centers that are closed. It's not uncommon to be in Mississippi and drive 40 miles for an emergency room visit, and when you get there, you find out that your hospital is closed. We've had people that die in transport. So we have tremendously, healthcare in Mississippi has deteriorated to the levels of the 40s. And all of us get together to realize that if we don't stop this and declare a full fundamental war on poverty, that these conditions are not going to improve. And I think the conditions, because of this COVID-19, is being exposed, but they are deteriorating as well. It's not enough to say we are exposing them, people seeing them, but I think the conditions are worsening as well.
Dr. Shirley Evers-Manley is the interim dean of the Alcorn University School of Nursing in Mississippi and a member of the board of directors of the National Black Nurses Association. We're going to hear from her now.
So we started when I was at UCSF. We actually had a global health program. So we worked with a variety of nursing schools throughout the world, from Africa to Asia to Europe. When I left UCSF and became the dean at Charles Drew University in Los Angeles, we actually made a program in global health nursing. And in that program, the students were able to learn about not only areas here and health disparities here in the United States, but also learn about global healthcare problems, health disparities in other countries. So we selected places to go based on our student population. And when you look at the student populations now in the universities and colleges, they're very diverse. So we had students from Uganda, we had students from Nigeria, we had students from the Philippines, we had students from Malawi. So all over the country, students from various parts of the southern countries as well, like Mexico and Brazil and those areas. So we selected areas to go based on what type of crises was happening in the country at that particular year. So we have gone to the Philippines because of the hurricane, the major hurricane in the Philippines. We've gone to Nigeria, we've gone to Ghana, Uganda. Each Saturday in Southern California, there's a team of nurses, pharmacy students from USC and also Charles Drew that goes over to Tijuana every year and provides screenings to individuals there. Locally and here in the United States, one of our largest programs we provided was to help the families in Michigan when they had the problem with the water in Flint, Michigan. So we actually was able to donate over 10,000 bottles of water to particularly go to individuals that was working with babies, because the babies can't be bathed in the water because it would leach, whether it was the iron or whatever was in the water, it would leach into the babies. So we provided diapers and baby wipes for that. Most recently, we have worked with COVID and provided homeless individuals with safety kits and food for those who have been isolated in their homes. So we've worked with isolated seniors, we've worked with homeless populations in Southern California, large homeless population there, homeless populations in Washington, D.C. We've been in New York where we've started crisis lines, because we want nurses to know that healthcare not only starts within the four walls of a hospital, but it starts in the communities where we live, work, and play. We can't do that alone, however, so we have worked with social workers, we've worked with community health outreach workers, and we believe in some states where they don't have a community health outreach worker system or program, that it would be very beneficial. Like, I've been in Mississippi here in Natchez for just a month. They do not have community health outreach workers here, but this is a rural area. And when you're looking at some of the data about Mississippi, they compare it to Namibia. I've been in Namibia, and I said the terrain is very much like Namibia. The difference is that there's several more people that live in those areas. So when you have a rural area and your workforce cannot meet the demand, it becomes a problem. So we have to look at nurses, frontline worker, nurses, physicians, physician assistants, nurse practitioners, and go down to the level where we can work with the community health outreach workers who are trusted by the community. They know the community, they know where people are, they know that there's a homeless population, they know that they live under the bridge or wherever they may be. So we work with those individuals so that we can be able to provide healthcare services to them as well.
Back to Tuskegee and Amelia Boynton Robinson and revolutionary, creative, nonviolent direct action. For people that don't know, Tuskegee, Alabama is primarily known because of the Tuskegee Institute, now Tuskegee University, founded by Booker T. Washington in 1881. It was also the home of the vice president of the Schiller Institute, Amelia Boynton Robinson, where we visited often with her. And when you talk about that institution, you talk about the idea, as people have heard it, of pulling oneself up by your own bootstraps. Sometimes that's misunderstood in terms of how it's supposed to work, but we have an example from Tuskegee. And what we were able to do a few days ago was to have a kind of roundtable with several individuals. This included former Mayor Lucenia Dunn, first black woman mayor of Tuskegee, City Councilwoman Norma Jackson, Scott Muhammad, from whom we found out about this entire project. And what you're going to see in the next excerpt is something from two individuals. This will be Erika Muhammad, who you'll hear second, and Chief Leon Frazier. I want to say a little bit about Chief Frazier. He will introduce himself, but he importantly took care of Amelia Boynton Robinson at the end of her life. She died 5 years ago, 2015, at the age of 104. He'll speak for himself, but he intended, when he filmed this, for the picture of himself taking her across the Edmund Pettus Bridge to show Amelia, but the graphic is a little bit skewed, so you won't be seeing her. He's unfortunately in front of her, and other individuals are prominent there. But his message gives you an idea of how one can use the methods of the civil rights movement in a different context, that being the present coronavirus pandemic.
The one thing that I would like to make clear, I'm Leon E. Chief Frazier. Chief because I've been in law enforcement for many moons and I retired as a police chief. That job gave me a lot of knowledge, and it's compounded my love for this nation. I love my people because of my grandmother and my mother and all of the other beautiful people who helped to make me who I am. And I love police because if there were no police, as unlawful as my community is today with police, we would be on a slippery slope to chaos in this whole nation. And so therefore, anytime I'm confronted with anything, I always look at it from a law enforcement perspective, which means protections and service for real. And I look at it from a humanistic perspective to say that this me, myself, and I perception that most of us have worked us into the mess that we're in now. And if we don't get up out of it and start unifying and thinking about we and being concerned about our sisters and brothers, and they're not all Black, then we are going to forever be in a rut. It doesn't matter whether you have a PhD degree, a master's degree, a BS degree, or no degree. We are all discombobulated, confused, and don't have a clue as to what the next move ought to be. Now, don't you think that this would be a time that we would think that we all need to come together now? But isn't this a time that we ought to get off this I am big high horse that we own? Isn't this the time that politicians ought to care about the people? Isn't this the time that police ought to care about citizens? But even more important, isn't the time that citizens ought to care about the police? So you see, we're expecting too much from law enforcement when we are too immoral ourselves. We lie, we steal, we kill, we take, and we do all of those other things that is not good in God's eyesight. And we expect then, though, the police to be perfect. They are trained to be this or that. No, I was never trained to let somebody spit on me and hit me upside my head and I tolerate it. I was never trained in all the 40 plus years that I was a law enforcement to let somebody abuse me. So now I don't expect no police officer to take abuse from no citizen. I don't care whose son and daughter it is. But by the same token, I don't expect and accept no police officer to abuse and misuse nobody. I don't care what their status of life. So my thing is, rather than stay divided, and I knew the police was going to be have to come into this thing sooner or later, and the police was going to have to take some action because I know how hard-headed some of our people are. They still congregate. They still socialize. Matter of fact, Brother Scott called me and we were talking. And Brother Scott say, I'm worried about these people over here that's having parties and acting like nothing's going on. Right away, I thought, well, it's just be a matter of time before law enforcement is going to have to go in there and do something to try to save these people from their lives, from themselves. So, do we do nothing? No, because Scott wouldn't respect me no more, being as old as I am, if I didn't do something. So what do? Well, you use your talent in law enforcement, your love for law enforcement, and you gather all of these guys together, police chief, sheriffs, and etc. And then you reach out to the community, all of the leaders, quote unquote, on leaders. And you say, look, we've got to do something, and we've got to generate a sense of respect and a sense of support and a sense of safety among the people in the community. Because if the police have to go there 3 weeks from now, 6 weeks from now, and start arresting people, we're going to have riots. What you coming here for? You can't tell me what. But if we can get the government, that was utility board, mayor of the city, and sheriff's department, and all of the other powerful people in the community to come together, put together a document that represent the whole government, then use police officers now, right now, before we start panicking, and have them go door to door and circulate these to the people. We got 5,000 printed. We've gotten about 4,000 distributed. And not only did we go with law enforcement, but we blended law enforcement with community organizations. So now you see a unified effort. So now when we go to Miss Crockett's house or Miss Rogers' house or Mr. Henderson's house, now 3 weeks early, if they have to be arrested because of a major party later on, the police officer would have to do the arresting. But could they blame the police for not caring nothing about them and trying to play police and law enforcement? No, we have to realize, because we could tell them, you remember 4 weeks ago when we came by your house, we gave you this document. It pointed out the city ordinance. It pointed out safety tips. It pointed out the state rules and regulations. It explained every aspect of what we were up against to the best of our ability. You remember that day? Yeah, I know you came by there. Well, then shut up there, because you should have paid attention. The governor told you, other people in the federal government told you, your pastors told you, because they stopped doing church and told you to go home and protect yourself. So now you couldn't declare that the government didn't care anything about the people, because the front line force of the government, law enforcement, was right there saying, people be careful, people be willing to understand something different, and people please take care of yourselves. So that's my testimony, is that with no time now for no separation, law enforcement people and community people must come together. Church people, law enforcement people must come together. And as a consequence, we must survive this pandemic together, because it is a whammy that is reaping havoc on everything and everybody.
I just wanted to add some of the things that we were able to do here in Macon County is our work with the university. You've heard about the Community COVID Task Force. That is a major relationship that came out of our work dealing with the pandemic. But we also were able to work with the university in getting more testing in our area. So throughout the Black Belt, we had virtually no testing at all. We are lucky if we can have testing 1 day a month. So we don't have accurate numbers because we don't have accurate testing, but we did get the university to agree to start manufacturing its own testing kit. And because they are a scientific university, they have the know-how on how to do that. So TM46 was able to actually offer testing where it didn't exist or existed in a way that was not very accessible. So that's one thing that came out of our work in the community that's very important, that can be reduplicated in other areas as well. And it is going to be increasingly easier to do as the testing technology improves. I want to also share a little bit about our health navigators. You know a little bit about our first outing, which was with our law enforcement community. So Chief talked about that. So we did a couple of outings initially like that, but then we were able to recruit young people in Tuskegee, mostly graduate students or recent graduates of the university. And we created a health navigator team, and they are peer educators. So that means that they're known to people in the community, and we will actually take COVID information door to door, because we're very aware that a lot of people just don't even have the correct information. So being able to deliver that information is very critical. And then the other thing that we discovered while going door to door is that the quarantine is creating an epidemic of loneliness, and there's a lack of human contact that's just not being addressed. Now, there are ways that can be addressed, but if you don't know that it's a problem, you can't come up with a way to solve that problem. So we, when we take the navigators out, we're very virus sensitive. So everybody is masked up and social distance. We don't go in the houses, but we make sure that the residents get the information they need. Another thing that we were able to do through TM46 is work with our elected leaders and the task forces, of course, all of our elected leadership in the county. So some of that work includes public policy, but we've had policy in the county and we had policy in the state, but it's not always being practiced. So we found out there's also a lot of public relations that has to go on in terms of why people don't take this virus seriously. There are so many different reasons why people don't take it seriously. There's a lot of rumors about it, that it might not really be a virus. It changes really by the week. But one thing we saw is that we have these statistics of how many people are catching it, how many people are dying from it. And we realized that we don't actually have a face to go with these statistics. So that's one of the things we're working on now, is being able to put a face to those people in our community that we have lost to this virus. And that really makes that real for people.
That concludes our progress report on the American work done on the Committee for the Coincidence of Opposites initiative of Helga Zepp-LaRouche. Our next speaker is His Excellency Ambassador Ayikoi Otoo of Ghana, Ghana's High Commissioner to Canada. His topic is Expanding the Health System in Ghana, 101 New Hospitals Planned Nationwide.
Fellow panelists and distinguished participants, greetings to you all. My name is Ayikoi Otoo, and I'm Ghana's High Commissioner to Canada based in Ottawa. I have participated in many Schiller Institute programs, and I'm pleased to be a panelist this time around. I thank the organizers for having invited me. Ghana, where I come from, is a West African country south of the Sahara, and first to have attained its independence from the British in 1957. At the time of independence, the British left Ghana with a huge infrastructural deficit, which successive governments have been fighting to improve. Amongst these deficits are energy, education facilities, roads, railways, international airports, health institutions, housing, etc., etc. Of course, in those days, ICT was not mainstream, but today Ghana has also been building its ICT infrastructure. By way of educational facilities, many secondary schools, polytechnics, and universities were built across the country by both the private and the public sector. I will here dilate on the health sector, which is the sector I've been asked to speak on. Government recognizes that significant progress has been made in improving the health of Ghanaians. Life expectancy has improved to 60.5 years for men and 62.5 for females due to access to healthcare and nutrition. Community-based health planning services, CHIPS compounds, has increased in numbers. National Health Insurance, NHIS, under universal health coverage hovers around 45% of the population. Ghana was the first sub-Saharan African country to introduce NHIS in 2003 through an act of parliament, which fully became implementational in the year 2004. Under the National Health Insurance Scheme, every Ghanaian is required to enroll in a health insurance scheme. There are 3 teaching hospitals, namely Tamale, Kumasi, and Kolibu, as well as a specialist hospital known as the University of Ghana Medical Center, which opened to the public last year. There are 6 COVID-19 testing laboratories in Ghana. The borders of Ghana opened on the 1st of September, and government announced all passengers arriving in Ghana will be subject to a rapid test at centers located at the airport. Those who test positive for coronavirus are isolated for treatment. The Ghana East Hospital, following the outbreak of COVID-19, was designated as an isolation center for the treatment of COVID-19 cases. Other wards of existing teaching and regional hospitals have also been set aside as isolation wards for treatment of COVID-19 patients. A new infectious diseases center was recently constructed within 2 months and has become fully operational. Ghana's COVID-19 deaths, as at August, stands at 217. Construction of new hospitals. Despite progress made in healthcare delivery, government has noted challenges that need to be addressed, which include huge imbalances in geographical access to quality healthcare, inadequate and inequitable distribution of critical staff, increased cost of healthcare delivery, and poor quality of healthcare services. Though over the years, various governments have built many community healthcare centers, district hospitals, and polyclinics, as well as tertiary and referral hospitals. Following the outbreak of COVID-19 pandemic, government announced its intention to build 88 regional hospitals. However, when a manifesto was unveiled recently, it was captured under the health sector. The government intends rather to construct 101 hospitals with accommodation for doctors and nurses in districts without hospitals across the regions. That is a huge boost to access to health delivery. Health institution categories. According to the Ministry of Health, the definition of a health institution by category are inter alia clinics, not providing full range of services, usually reproductive child health, RCH, or basic curative services. Health centers, providing full range of basic primary health care, PHC services, clinical, public health, and maternity services. Polyclinics, providing an expanded range of PHC services much higher than a health center, but in terms of capacity, less than a district hospital. District hospitals, providing full range PHC services of a general hospital under the management of at least 2 general duty doctors. These health facilities are a conscious effort by government to expand access to healthcare for Ghanaians across the country. By way of funding, government wants to be careful not to add to the debt stock of the country, and therefore it is looking at flexible terms of funding such as public-private partnership, build, operate, own, and transfer, or concessionary loans. Government, through the Ministry of Finance, is working out the modalities for the funding, and to date, nothing concrete has been announced as to the funding model. The only information out is that government is desirous of awarding the contract to Ghanaian contractors. I don't think that has anything to do with funding. It ought to be stressed that the move is to prevent a situation where financiers bring in their own labor, depriving Ghanaian workers the opportunity to derive some benefits from the project. I shall be ready to share the funding model or regimen as soon as it is made public. I thank you all for your attention.
Thank you, Ambassador Otoo. And our final speaker is Marlette Kyssama-Nsona of Republic of Congo, a pharmacochemist, political executive of the Pan-African League UMOJA, and specialist in public health issues. The topic is health security. Africa has to build a continental health program, the case of the Congo.
Mesdames et messieurs,
Ladies and gentlemen, on behalf of the Pan-African League UMOJA and on my own, I thank the Schiller Institute for having associated me to this panel for exchanges on themes highly essential to the survival of the human species. The COVID-19 pandemic has revealed the peril that humanity, including the wealthy nations, are in because of a predatory economic system whose sole objective is to capture and accumulate collective resources to the benefit of a handful of cosmocrats. The people of Africa have been experiencing this peril for 30 years. Indeed, since the 1980s, Africa is bending under the yoke of an odious debt that has become unsustainable and of the structural adjustment measures imposed by the IMF and the World Bank for the sole purpose of repaying this debt, with the benevolent complicity of a local comprador elite. Thus, in terms of public health, the consequences are disastrous. Over the last 30 years, budgets for public health programs has been cut. In the case of the Congo, the rate of execution of budgets devoted to health has fallen by nearly 7% over the last 10 years. According to the World Health Organization, per capita health spending is $6 per year compared to the 30 required, according to the same source. The same is true for the general infrastructure and for the technical platform that has become obsolete. At the height of the COVID-19 pandemic, the country had less than 5 respirators. The training and recruitment of medical and paramedical personnel is in the same condition. Congo has 0.3 doctors and 1.9 nurses and midwives per 10,000 inhabitants. In comparison, Cuba has 77. The part of the budget devoted to basic research and investment in research and development in the biomedical field has been reduced to a very small fraction. The Congo imports all its medicines. A social security system has not been subsidized for more than 30 years. As a result, there is no social protection. In the Congo, to get treatment, one has to pay on the spot and expensive. Thus, many families sell their land holdings to have a chance of allowing one of their members to recover their health, even if the outcome is often fatal. A session of chemotherapy can cost up to $600 in a public hospital, while the Congolese minimum wage is only $120. A cesarean is worth up to $400. For example, in Congo, the maternal mortality rate is 780 deaths per 100,000 births, one of the highest in Africa. However, the most perilous consequence is undoubtedly the weakening of the state, which, in order to obey the diktats imposed by the IMF and the World Bank, finds itself stripped of its prerogatives, including the possibility of thinking and building a health system that conforms to the expectations of the population. Here, the state has been replaced by NGOs, some of which act as Trojan horse for the multinational drug companies without any overall conception. Erratically, and in a homeopathic dose, more like a wooden legs. The free trade agreements concluded between our countries and the European Union have made Africa the recipient of diced meat and other poultry unfit for consumption. In the Congo, what we eat kills us. Because of high production costs, the average price of a locally produced chicken is $6 compared to $2 for an imported chicken. The issue of health is closely related to the food issue. Ladies and gentlemen, we all know it. The globalist oligarchy operates by attacking the normative powers of states. It is therefore necessary to rehabilitate the state, allowing it to recover all its instruments of sovereignty, so that it can fulfill its regalian functions, the most important of which is the protection of its population. And this involves denouncing the debt and the dictates imposed by the IMF and the World Bank. It is the responsibility of the state to think, implement and finance public health policies. Moreover, Africa does not live in a vacuum. It is contributing to the collective effort by making available to humanity its millennial knowledge and its rich pharmacopoeia. African researchers, like other researchers around the world, reflect every day on the search for solutions. Africa is an experimental field for many pharmaceutical companies to test a new medicine or a new vaccine. It is therefore unacceptable that drugs, fruits of the patrimony of humanity, be made inaccessible to a part of the same humanity because they are sold too expensive. It is necessary to put an end to the patent blackmail operated by pharmaceutical laboratories which, far from fulfilling their primary mission, engage in speculation and have contempt for the collective well-being. The world must take a vital turn. We need to get out of the financial economy, or else risk destruction for all. What was true yesterday only for the Third World is now also true for the West. This is a responsibility our peoples must take up. Thank you very much.
All right, so we are now going to resume our question and answer period, and so we're going to bring everybody up for this section of the Q&A. Let me also say, because people are asking, send questions to questions@schillerinstitute.org, and we will try to answer them. Also, I would just let people know that we will forward questions that have been, because there are many, many questions now for the panel as a whole. And I believe, let's see, we've got Dr. Peters there. We've got Dr. Shirley Evers-Manley. Dr. Elders is with us. I believe that Ms. Kyssama-Nsona is there, Dennis Small, and Helga Zepp-LaRouche. So let me first ask the panelists whether they have anything to say or in terms of what you've heard in this next segment, or those of you who have just joined us. So I'm going to start, Helga, with you again.
Well, some of our participants who are not so familiar with our work may have asked themselves, what has all of this to do with each other? You know, what is the problems in Tuskegee and the problems in Africa, and what others were talking about? I mean, this idea, and this is also in part an answer to Natalia and her proposal for this committee. When you look at the situation, it is very clear that this whole society globally is really falling apart. It's in a deep crisis. You have a strategic crisis. You have, the health breakdown. You have the social tensions in the United States, to put it mildly. So, looking at that, I just thought that the only conception which solves all of this is an idea of Nicolaus of Cusa, who was a thinker of the 15th century, who at that time said that if you have a systemic problem, you have to find a solution on a higher level than the problems, than the level on which the problems were arising. This is, by the way, something which Einstein also talked about repeatedly. And Cusanus developed this idea that the one which the human creativity can think is of a higher priority and higher order, higher power than the many. So if all the many agree to do something which solves the problem for all, then you can actually solve the problem. And right now, I think it's very clear that, you need a just new world economic order which addresses the problems of every part of the world, of every country, but you also need to overcome geopolitics. You need to overcome the supposed competition between countries because they should be united by one cause. The same thing goes for social tensions, where I'm not talking about now the terrorist element, which is causing the violence and the destruction, but people who are generally concerned about that there are many parts of the United States and even Europe who are not participating because they're not, they have never been integrated into the system of taking benefits for their own personal life. So the idea was that we should get a movement, a committee of the opposite coincidence of opposites, which takes different elements and brings them together to jointly solve the cause. Starting with the young people in the United States, who many are desperate. The suicide rate is very high, the drug addiction, the violence. And in part, this all comes from people being full of despair, having no vision for the future, thinking that, alcoholism and drugs and so forth is the only way to go. So the idea was to find people from different layers in the United States, especially the medical and related professions, and get them to set up training programs for young people to help become assistants with the COVID pandemic, but then quickly team them up with corresponding hospitals and universities in Africa, because you need to address that problem at the same time. And then also, and I think Mrs. Nsona correctly pointed to the fact that you can't separate health from food, to team it up with the farmers, because the farmers, and we will hear about that in the next panel in the afternoon, the farmers, while you have a famine going on, which is threatening soon hundreds of thousands of people to die every day, the farmers are being destroyed and are being prevented from doubling and quadrupling their food production by the cartels, which are only interested in the system of profit. So the idea of the Committee of Coincidence of Opposites is really to build a mechanism whereby the medical people training young people to help in this crisis, give the young people a mission, but at the same time linking them up with their African and also later other countries' counterparts, linking them up with the farmers, and by creating in the small a model how you would actually solve this problem, by mobilizing lots of people who see the need, and this way create a model which hopefully then can be adopted by the governments at large, because obviously a private effort, as I'm talking about, cannot solve the gigantic problem, but we can create a model of what the governments should do. And that way also build a bridge, to not have race riots, to not have race tension, but to work together. Because I think that we have reached a point in human history where either we are able to make that mental leap of thinking the higher level of what unites us all, or we may not make it as a human species. So that is really something I just wanted to give as a background for those people who have not been discussing this idea. And I think that this idea that we have to get to a higher level of thinking is the absolute key to solve this problem.
All right, I just want to ask a question just for my own knowledge. Is Ms. Kyssama-Nsona, are you able to hear us, first of all? Do we have an interpretation for you?
Oui.
Okay, very good. All right. Do you have any comment at this point?
Oui, bien sûr. D'abord, je voudrais remercier l'Institut Schiller et l'ensemble des panélistes de la qualité des débats. On se rend bien compte que la question du Covid-19 a permis, s'il était besoin, aux uns et aux autres de se rendre compte que l'humanité est en péril. Parce que jusqu'ici, nous étions coutumiers du fait que c'était l'Afrique, l'Amérique latine, l'Asie qui étaient concernés par les catastrophes humanitaires, par les situations sanitaires difficiles. Mais cette fois-ci, on a pu se rendre compte.
Maybe I can translate.
Yes, please.
Can you hear me?
Yes, we can.
Yes, okay. So first, she wanted to thank all the Schiller Institute and all the panelists who intervened today. It was very, very interesting. And what she was saying is that the COVID-19, pandemics have really shown to humanity that humanity is in danger today. So we have to face it. And for most of the people in the world, and until now, they think that pandemics, food crisis was only for Africa or for some parts in Asia. But now we can see that we have this crisis, pandemics, food crisis all around the world.
Oui, donc les choix économiques qui ont été faits après la Deuxième Guerre mondiale, finalement, impactent tout le monde. Aucune nation aujourd'hui est épargnée. Moi, je peux vous dire que depuis le Congo où je me trouve, on a suivi avec beaucoup de... On était effarés de constater à quel point l'Europe, pour avoir délocalisé son industrie en Asie, s'est retrouvée incapable d'avoir des masques, par exemple.
Okay, so what she was saying is that we have a clear sense today that the choice which have been made after the Second World War, the economical choice which have been made, have been a total disaster from this time on. And if you look at the situation, if I look at the situation from Congo, Brazzaville, here where I am, we were very astonished, and it was very unbelievable for us to see from here we have a lot of problems, to see that the disindustrialization and the mondialization which have delocalized industry and jobs from Europe to Asia, and that today even Europe was not able to have masks and to be prepared for this pandemic. It was very shocking for us.
Donc, cette logique de profit, accumuler du profit avant l'humain, je pense qu'aujourd'hui, on est tous d'accord pour constater que nous avons échoué collectivement. Parce qu'il s'agit d'un échec collectif de l'humanité.
So, she said that the accumulation of financial profits since World War II with this pandemic, it shows that we are all agree from the north and from the south, that we are all agree that the economical choice that we have made were a total failure. And today we know that humanity have failed with this financial and this economical choice.
Et donc, voilà, c'est le moment d'ouvrir la réflexion, en tout cas de poursuivre la réflexion sur le monde que nous voulons. Comment est-ce qu'il faudrait faire pour que nous puissions préserver l'espèce humaine? Parce que je pense qu'on en est à ça, à réfléchir à comment préserver l'humanité sur Terre.
So she said that it's time now to go on the discussion that we have started together, to open your mind and decide which kind of world we want the next day, the next month, in the next period. Because for me, and it has been said, everybody knows that today we have to save the human species. For me, we are at this point. We have to save human species in a whole. Thank you very much.
Okay, very good. Actually, I have a question which somebody asked. Dr. Evers-Manley, can you hear us? Yeah, there's a very particular thing that someone, and I'm only going to, because it happens to go with what was just said, was asking, actually two different people, that you mentioned that you had worked in several countries, not merely in Mississippi. You mentioned Namibia at one point, you'd been there. What the question is, what other countries did you work in, and what do you think are the important differences to figure out if we are going to be able to stop the pandemic, given the differences in countries and health systems?
Okay, thank you for the question, and thank you for allowing me to have this discourse with you this morning. I've been in Ghana, both in the northern and eastern part of Ghana. I've been in Uganda. I've been to Morocco, to the Philippines, to South Africa, Botswana, Zimbabwe. And I think in looking at all of those countries, the one thing that I find that binds us together is that we have a strong sense of networking and communication in our communities. And when you learn that networking and you learn that communication, and we're able to go out and work with the individuals on their strengths, weaknesses, and opportunities, then we are able to help them, develop a clinic. For example, when we were in Zimbabwe, there were several infants dying of HIV/AIDS at the time. We helped to build a clinic that's still sustainable. We taught the children, there were several foster children because their parents had lost their lives because of HIV/AIDS. We taught them how to become community health outreach workers and CNAs so that they can learn how to take blood pressures. We worked with the farmers so that they can learn they have peanuts. And we worked with them in regards to how they can take the peanuts and make peanut butter and make all different types of things with the peanuts, and how they can sell the peanuts. So going into that farming and sustainability and food, but also bringing resources in. So in learning those particular communities, helping them understand health for themselves, for individually, what is our health going to be individually, because we have to be role models, and then building on that and then helping each of the communities. So I think if we're going to make an impact, and especially now, I think what COVID-19 has provided us with is a level playing field. As one of the presenters just said, all of us have had difficulties to access to food, and all of us have had difficulty moving about. In San Francisco, where I've lived, in Los Angeles, and Washington, D.C., I'm close to all resources, but I couldn't get there. In Mississippi, I'm not. I'm in a very rural part of Mississippi, but I can't get there. But if we learn from the things that we were taught when we were growing up, and I was sharing with the team, last week, one of the things that I really respect when I'm in Africa is that everyone comes together and sits at the table. They eat at the table, but before they eat, they wash their hands, they pray collectively, and they eat as a family. We have lost that as a culture here as we've become more industrialized. And as a former chief nursing officer of 6 hospitals on the East Coast and the West Coast, and everyone can look at our Joint Commission rates, hand hygiene is a major issue. So I respect that in our African countries and our African nations, that they do not forget to do that. So sometimes looking back to move forward will help us in the crises that we're having today.
Yes. Dr. Evers, I failed to ask you whether you had anything to say at all. So you may have some thoughts about what you've been hearing. I understand you've been with us the entire time.
Yes, I have.
It has been very intriguing. I got up this morning in California, so I'm in California right now, and listened to all of the presentations on the economy. And if we don't have a healthy population, if our population is unhealthy, and for example, I was looking at the data as I'm trying to familiarize myself with Mississippi. The diabetes alone cost the state of Mississippi $180 billion. So if we're looking at improving our health status and being serious about that, we keep talking about it, but we still have food deserts. Or if I go to Mississippi and they have it costs $800 billion for diabetes, why can't I have a choice of the type of drink that I want to have? For example, they have sweet tea and they have extra sweet tea right in the areas where there's a major problem. So if we're serious and we're not industrializing everything and industrializing healthcare, and we're looking at the areas where we need to have the appropriate healthcare access, the appropriate access to the right types of food, then I think we're going to be where we are now. We have heard many times in some of the education that I've done throughout my career in healthcare, from public health to providing healthcare in an acute care setting, that public health is a dinosaur and we don't need it. So in some schools, you don't even get the public health education anymore. So we have to really look back and probably go back to our foundations, of health, of disease, of preventing disease, and looking at society as we are now in this industrialized world to make sure we have the right foods, the right healthcare access in the communities that we live, work, and play.
Thank you. Dr. Elders, you have anything you'd like to add here? I think you're muted.
How do I unmute?
Now you're good.
Okay, I'm good now. Okay.
Yes.
Well, one thing that I think that I like to add is, it's been said several times, but I think we need to start educating all over the world early. We do too little, too late. I think the what you brought up about what they do in the African countries, they start, we need to do more of. But, so I really propose that we really start early childhood education, make young people start early, that we began to make sure that we involve public health is more important. As far we can do more about saving lives and decreasing the spread of this COVID-19 virus by the simple things that's taught in public health. Simple things like washing our hands, covering our face, wearing a face mask, not only to protect ourselves, but to protect all our friends and neighbors. Social distancing. But so we need to learn to respect others, but that's true for the whole world. And until we really stop this virus, not only here in this country, we can't really stop it for the whole world. And I think much of that starts with education. We're all trying to develop a vaccine. We're all trying to develop good medicine. And we all know that that's important. And we all want it. And we feel every country, every neighborhood, everybody should have it. But until we can work together, solve this problem together, we've still got to do the simple things that we can all do. We can all certainly, like hand washing, making sure we wear a mask, stay out of huge crowds, social distancing. So these are things that everybody can do, we can do now. And until we get that vaccine, until we get all that wonderful medication we all know we need, well, we've got to start now. And I feel that everybody, everywhere in the world has a right to health care. And we know that that's not done everywhere.
Diane, we're going to go to you for questions.
Okay, good. So we have a question that came in from France, which I'm going to direct to Dennis Small from Daniel. he asks, to establish the national sovereignty of each country and stop globalization, what do you think of a generalized Glass-Steagall, and then he adds, antitrust law for each country in the world? This way, a multinational company will have to account for each national independent subsidiary without the possibility of playing with tax havens.
There we go. Sure, but that's only the very, very beginning. That alone will not be sufficient because you have to stanch the flow of blood, but you also have to revive the patient. We have no choice but to develop the productive powers of labor around the entire planet so that the potential relative population density again rises so that it's above the actual population, or we will have mass genocide. That requires not simply a Glass-Steagall type of solution, but it actually requires, in addition to that, then creating the kinds of institutions to build the projects, to engage in the kinds of activities which we've been discussing here. All of this can be done. It's absolutely feasible, but we have to have that approach to physical economy. Let me again take the occasion to say that I really think the answer to this lies in the original proposal for this conference, which is to form an urgent chorus of voices to demand and insist that a meeting of the P5 nations occur to address all of these crises immediately so that they can be addressed. I found just an incredible similarity or a congruence of the proposals that were stated by Natalia Vitrenko, and I would like to second her call for forming that kind of a committee of everyone from the world and the people on this webcast to participate and get our respective nations on board. What Dr. Elders was saying, I took some notes. We have to work together no matter how opposite we are, and we have to do this everywhere in the world. That's Franklin Delano Roosevelt's phrase. And of course, Helga's call for the Coincidentia Oppositorum, or the formation of a chorus of voices. This must be a political mobilization of a chorus of voices internationally to bring about the kind of change now while we still can. The clock is ticking. Every one of these crises can destroy our very precious human species. So we have to make sure that we turn this around now and use this meeting here as simply the platform, the stepping stone to what we have to bring about internationally. That's what has to be done. And of course, Glass-Steagall is a measure within all of those type of procedures.
Okay. Diane, you have another question?
Yes, and I think this one Helga may want to answer. It's from Ricardo in California. He says, it appears that any normal thinking person would agree with development everywhere in the world. The benefits to all are clear. The problem is there exist forces in the world that seek to undermine this development. Isn't this the real issue that needs to be addressed? Exposure and then removal of such obstacles.
Yes, absolutely. I think yesterday, I don't know if you listened to the discussion, the earlier panel. I mean, basically, I made the point that, the people or the forces who want to keep the status quo of no development is really the British Empire. Now, people tend to say, the British Empire vanished the latest when the Hong Kong was given over to China for this intermediate status in 97. But, the British Empire is not something which is located in London alone. It is what my late husband used to call a mushroom, a slime mold. Which changes its form. But the Roman Empire was an empire. Then it went to to Byzantium. It went to Venice. It went to the Dutch Anglo-Dutch Empire. Finally, it became the British Empire. And as I tried to develop yesterday, it is the subversion of the United States and part of Europe, I must say, with that British conception to run the world to the advantage of a small privileged class of bankers, of speculators, of cartels. And these are the people who like profit more. I mean, they don't like investment in infrastructure because infrastructure is not profitable if you want to make 25% a year. Even the MOUT system, you know, I don't know this word in English now, what you put up on the highway every 50 kilometers to collect money. What is it called?
The billboard? Tolls.
No, when you tolls. You know, you cannot finance a highway with tolls. I mean, it's ridiculous. You cannot build a trans-African railway system like the Chinese have for China and put a toll booth every 50 kilometers. So, you know, the problem is we have to get rid of that speculative class. This idea that you have to have a small elite of financiers, speculators, who at the expense of the populations of the world, making the gap between the rich and the poor wider and wider, that system has to stop. And this is why, you know, we are putting so much urgent emphasis on this P5 summit, because if it's not the P5 summit, it should be only, as was yesterday discussed, the three most important countries, the United States, Russia, and China, or with India. India right now is unfortunately being on a wrong trajectory concerning the cooperation with China. So I'm not emphasizing India so much at this point. But we need the top governments to make the radical revolutionary changes to allow for the survival of all of humanity. Now, will they do it? That is why we need this chorus. We need a chorus of people who demand that the governments are doing it. Because, you know, if the G20 would be capable, they would have done it already. But within the G20, I'm afraid there are several countries who are part of this usury system, and they will oppose such a change. So, you know, this is what we have to think in terms of organizing really a mass movement, but not a mass movement of people who just, you know, don't know what they're doing. But we have to recruit a mass movement of leaders, of community leaders, of state leaders, of, you know, institutional leaders, or people who just stand up in front of this crisis and say, I will become part of the solution. So that is what the Schiller Institute is trying to do. This is why, especially since April of this year, we conducted several international conferences in trying to bring together the alliance of forces, you know, because people normally, they're doing the good thing in their country, but they don't know what is happening in other continents, while the oligarchy is absolutely working as an international force. And, you know, despite the fact that our forces are relatively weak, I think in a crisis situation like that, it is not what you normally would assume in terms of power. It's the power of ideas. And I think that right now, the idea that mankind needs to move to a completely different mode of thinking the one humanity first, and then define your national interest. And I liked what Dr. Munoz said earlier, that he signs all of his articles as being a world citizen. I really think that that is a very good idea, because you have to think as a world citizen. You can be and should be a patriot, but this should never be in contradiction to your opening your heart for humanity as a whole. And we have to recruit a whole, you know, mass movement of people. And I would actually suggest that maybe we should expand this committee of the coincidence of opposites, and not just limited it to the health question, but to this effort, you know, to this effort that the time has come to put the coincidence of opposites ahead.
All right, very good. What we're going to do, we're at pretty much our close, and what I want to do is that we've had a series of questions. Some of them are directed to some of the individuals, and then there's some general ones. what I'd like the speakers to do is I'll read the 4 questions. I think 2 of them are for respectively Dr. Elders and Dr. Evers-Manley. And then we have 2 general questions. And so we're going to ask that everybody say something. This will also be, you want to think about giving this as sort of your final words here. And then we'll have a conclusion from Helga. So here are the questions. So first to Dr. Elders. This is something Dennis Small may also be interested in. Please speak to the issue of the Hill-Burton system versus the current state of health care. Hill-Burton being that system of hospital beds per 10,000 persons that had been standard in the United States prior to the 1970s. Then the question for Dr. Evers-Manley is, despite the you were identified as being on the board of the National Black Nurses Association. Therefore, you probably have a national picture of nursing around the country. Despite the pandemic in the United States, we have heard that more and more hospitals are going into bankruptcy in the United States. And nurses, despite the need, are being furloughed. Can you tell us why you think this is occurring and how there can be a national call for saving as well as expanding U.S. medical infrastructure and skills? Okay, we heard the ambassador from Ghana discuss the national plan to build 101 hospitals there, including positioning those hospitals throughout the country, including in rural, less accessible areas. Can we use that example of thinking from Ghana to get Americans to bring back the Hill-Burton law? So it's sort of like the first question, but more detailed. Then there are 2 general questions. The first is, in the United States, we often get requests for contributions to programs that engage at a village level around the world, but some of us at least know they may help a few people, but will not generate what is necessary. How do the speakers see the interface between major infrastructure projects and village level programs? And then this final question, which will tend to be something that Diane and Helga will probably want to answer, is in the spirit of the coincidence of opposites, what role could our virtual chorus singing and other music play in accompanying health volunteers and others to counterpose the beauty of their dedication and the music to the ugliness of the COVID virus and racism? So those are the 4 questions. And so what's going to happen here is I'm going to ask each one of you to say something. And this will be basically your final statement to this panel. So maybe we should start with Dr. Evers-Manley. Are you unmuted?
Thank you. Yes, I'm unmuted. And, you know, I had to take a deep breath and really think about that question because it's a very critical question. I think it's a question that can take further dialogue outside of this conference. The nurses are being furloughed because many of those nurses that's probably being furloughed are working in surgery, outpatient surgery, or in OR. And if you recall, many of the surgeries were canceled. With that being said, we already knew as nurses that 2020, which we're here now, we were going to be short 1.2 million nurses across the country. New York, California, Texas being some of the higher areas where there's a need for nursing. And if you look at how the pandemic has been going, you can see where nurses have been leaving one state, going to another state to work in those hospitals. And when they come back to their hospitals to work, you know, to help out, they're not getting their jobs back. So when you look at nursing, right now, nurses are not working to the highest of their degree. So the RNs may not be working as the highest of their degree. The nurse practitioners are not working at the highest of their degrees. So we have a lot that we need to discuss in regards to how nurses are used in the hospital setting. So the nurses that they need right now are nurses that are more used to working in ICUs or CCUs with respiratory problems, but you know that's how COVID first presented itself, was with respiratory. Now we're seeing it having an impact on all other issues. We have the issue where in some hospitals, because some of the Medicare laws were lifted. So you have people going to emergency rooms and they're saying, oh no, we're going to turn you away, go to another place. Just recently in Detroit, somebody took their father to several different emergency rooms to try to get admitted. And that person wasn't admitted there because they can go in and say, we don't have enough ventilators, or we don't have the PPE, and this person has COVID, and you know, African Americans in particular have other chronic conditions. So if this person has COVID and diabetes or congestive heart failure, then we're not going to do the care that we need to do there, and we're going to go to someone else. So there's so many different things that's happening, and I can share with you as a chief nursing officer and as a dean. There's been, we turned thousands of applications away because we don't have enough nurses to teach the next generation of nurses who are actually going to be in the hospitals. So yes, there's a shortage of nurses, there's a need of nurses, but at the same time, there's hospitals that are furloughing nurses. The other problem that we look at in regards to nursing is that when you go across the country, there's different models on what they feel patient ratios. So that means nurse taking care of a patient. California is the only state that have a law on how many patients a nurse can take care of. Other states, you don't. So when you have one nurse taking care of 7, 5, or 6 patients, and some of them may be COVID patients, that becomes a problem. You have some hospitals that said, okay, we're only going to have nurses work with COVID patients only, and some nurses that don't work with COVID patients because they want to prevent the accidental spread of COVID. So that has to be looked at, because, you know, if I work in a radiation unit, for example, I can only work a certain number of hours or a certain number of times so that my body can have a time to relax. Do we know that for workforce individuals in nursing, that if they're only working in COVID every day, 12-hour shifts, stressful hours, very difficult patients, what vulnerability do they have as nurses, where we're still hearing that there's problems with PPE? So I'm kind of going in a lot of different areas to get things in very quickly to give the other panelists an opportunity to speak, but there's several different issues. There's several issues that we need to peel back layer by layer so that we can address those issues for those nurses that's being furloughed. And probably the more important thing is that rather than furloughing the nurses, as we've said, we have destroyed our public health system. There's not enough nurses in the public health system to even go out and check on isolated seniors. I know for a fact when we were volunteering here in Los Angeles, we took food to one senior one day for Mother's Day. That was the last time she was seen. When someone went to check on her again, she had died. So how many people do we have that's happening like that, that's isolated in their homes? And as we think again, more rural areas, and as I shared, when they're saying Mississippi is like Namibia, very big and spread out and very rural, who's checking on those individuals? So there's a lot. I'm very passionate about that, that we're looking at this, that we're not laying off nurses and that we're not furloughing them, but we're using them in other areas, and that we really look at what are the policies and procedures for these frontline workers that's in the hospital taking care of COVID positive patients, in addition to all the other patients that they still have with cardiovascular disease or cancer that's on chemotherapy, that they may say, go home, we can't treat you at the hospital. You can't stay overnight because we don't want you to, to contract COVID. But what are we doing with those patients?
Okay, thank you very much. Ms. Kyssama-Nsona? Is anything? We're not able to hear you. You have any remarks? You may want to check her audio. All right, well, then we'll go to Dr. Can we hear you?
Yes.
Okay. Her audio is muted.
Oui, merci.
Okay,
Oui.
now we're fine.
Vous savez, dans la culture africaine, nous avons ce qu'on appelle la solidarité de droit. C'est une pratique qui oblige chaque membre de la communauté à venir en assistance à l'autre en cas de besoin.
Okay. Okay, you know, in African culture, we have what we can call a kind of solidarity right. It's like a civil right, but for solidarity. And when we have a problem, each member of our community has to help another member of the community if she or he has a problem. That's in our African culture.
Et en l'absence de protection sociale, ce sont ce genre de dispositions-là, liées à notre culture, qui permettent aux uns et aux autres de se soigner. Parce que l'oncle, la tante, le cousin, la nièce apportent de l'argent, on fait des cotisations et la personne peut se soigner, être à nouveau en bonne santé.
You know, as we have not any state assistance, state medical assistance, state protection, it is our culture who save us. Because when we have an uncle, a cousin, we have a big problem, a big medical problem, everybody is talking to bring the money, to find a way to have all the money which is necessary to help him to have a remedy for his sickness.
Mais les mesures économiques qui brisent les populations font que même cette disposition-là, aujourd'hui, est difficilement respectée, difficilement accomplie.
But with the degradation of the situation, because things are going worse and worse in our country, even this cultural tradition have a tendency to disappear because there is so many problems around everybody.
Par exemple, dans le cas du Congo, il y a des paysans qui ne peuvent plus vivre de leur travail parce que ils sont soit éleveurs, soit ils produisent des céréales. Le fruit de leur production ne peut pas tenir la concurrence par rapport à ce qui est importé. Et beaucoup finissent par abandonner ou beaucoup vivent dans l'extrême pauvreté. Il s'agit là d'une pauvreté structurelle qui est créée, qui est générée par l'économie financière.
For example, you have to imagine that here in Congo, even our farmers, you know, people who have cattle, or people who are we are producer of wheat or different cereals, cannot live anymore with their production. So because of the free trade policy, you know, everything which is imported is less expensive than what we are producing here with our farmers. So because of the financial system, today in our country, farmers have to leave their land, you know, and stop to be farmers because of this free trade financial policy.
Les gens perdent même leur dignité parce que ne pas être capable de prendre soin de soi, être obligé d'attendre qu'une ONG vous vienne en aide, quelque part, il y a atteinte à la dignité de chacun.
And worse of that is that people are not only losing their production, they are losing their dignity. And it's very, very, very important for us in Africa to keep his dignity. And we have to wait from NGOs, for example, to help us. So it's a kind of an attack against our dignity.
Et quand la pauvreté est créée de cette manière-là, quand elle est entretenue, elle va inévitablement générer des conflits.
And when poverty is created, because that's the problem today, poverty is created. And at the end, when you have this poverty, you can be sure that you will have conflicts and wars.
J'insiste particulièrement là-dessus parce qu'on ne peut pas faire l'économie du lien entre la pauvreté structurelle et l'accès aux soins. Les deux vont ensemble. Il faut traiter la question à la racine. Ce qu'on peut faire ce qu'on peut porter comme palliatif, évidemment, ça fonctionne, ça aide, mais ce ne sont pas des solutions sur la durée. Nous devons porter une réflexion à la racine, en profondeur, sur ces questions-là. Si nous voulons vraiment aller de l'avant, il faut réfléchir à la racine. Voilà ce que je vais moi rajouter.
So that's why I emphasize, yes, I emphasize on that. I want to really emphasize on that, is that we cannot separate health issue from the food production. It's not possible because we have to have people in a healthy situation and be able to feed themselves. So I really emphasize on that. It's the same subject. And we have to go to the roots of the subject because today we are too much living on waiting help from outside, and we don't need help. We have to go to the roots of this problem, have a real health system and a real production of food system. Thank you very much.
Yes, thank you. All right, I want to go to, I think, Dennis Small.
Okay, sure. I'll take up the question of the Hill-Burton and also some of these issues around the nursing shortage and one additional point. I mean, we've just heard this anguished picture of how you have a massive shortage of nurses in the United States, and when people desperately need nurses, we're not getting the two sides together. It's exactly the picture we're going to hear this afternoon, where we have nations, entire countries, populations starving to death, and farms are being bankrupted. Maybe there's a problem with the system. Maybe there's something fundamentally wrong when the central banks of the world, like the Federal Reserve of the United States, issue $4 trillion of credit, not for production, not for health, not for food, not for industry, not for technology, not for railroads, but to bail out the banking system. We're in a systemic crisis. This system is dead. It's over. And it's very possible that as the institutional collapse that goes on extends outward and the conditions people see no answer, see no remedy, if they don't, people may very well go stark raving mad before they die of hunger. That's the problem that's going on right now. Our answer, our solution, the idea that there is an answer, even before it's fully implemented, is absolutely critical to the situation. In that regard, and many others, I want to reiterate my concluding point from my remarks this morning, which is that we must obtain the exoneration of Lyndon LaRouche. This is not simply a matter of personal interest or one case of injustice. This is a man, the man, who provided not only the philosophical and scientific ideas to solve these problems, and the ignoring of those solutions lie at the root of what we're seeing today, but Lyndon LaRouche as well served as a kind of moral example, as a compass, a moral compass of what human beings should actually be, the idea of living for the common good. And I dare to say that unless and until we in the United States in particular bring about the exoneration of Lyndon LaRouche with the help of that same chorus of voices internationally, unless and until that happens, we will not regain our own moral fitness to survive.
Dr. Elders?
Yes. You know, we've talked all morning and we've not talked about, we've talked about this virus that's kind of exposed our marked underbelly of what's going on and all the problems that we see and that we encounter. But I think it's time that we've not talked about prevention. The most important thing we need to do is we could prevent this virus. Now we have 25 million people that's been exposed when we probably could have stopped this had we educated and taught our communities, our young people, even our public health system, our doctors, to make a difference. We talk about money to build more hospitals. We may not need more hospitals. Why? If we prevent the problem from happening, we don't need more beds and more people to take care of them and more ventilators. What we need to do is teach our people how to be healthy. And that's what we were talking about. And I think Helga's idea of teaching our young people what they can do at our communities to really begin to make a difference. We need to reach out and be responsible. And that's what we as a world have really not done. We've got to educate and empower all of our people. It's not, we talk about the education of more doctors, more neurosurgeons, but we've got to educate and empower our young people to prevent this problem. If we did that, we would need more ventilators, because the people could be educated and empowered on preventing the problem so that it wouldn't spread so rapidly. We've got to be the voice. I feel that what we can do, we've got to be the voice and the vision of the poor and the powerless. Powerless people in need of powerful friends like ourselves. And I think this group has tried to do. We've got to be able to put that together, use it, and be the powerful voice, be the 2020 vision of this century. And I think I talk about what we've lost. I heard you talk about, we don't eat together anymore. We don't visit together. And we all know that that's going on. Not on, some countries still have it, but we've lost it. But as we educate and reach out, we've got to do the things we need to do. We've got to learn to network. We talk to each other and we talk to people like ourselves, but we don't really network all over the country. We've got to use the tools of commitment. We've got to give up our time, our talent, and other, I always call them the 3 tools: our time, talent, and our connections. We've got to be involved. We've got to continue to do high quality research, but we've got to invest in people, invest in public health, we've invested in the big things, invested in banks, but we've got to invest more in our people for the groundwork to be able to increase and make things better if we're going to really do the things we need to do. We've got to take every opportunity we get. This virus has given us an opportunity to wake. We're awake. We'll take every opportunity we get. I always, as my husband, who's a coach and who's sitting here with me, says, opportunity is like a single strand of hair on a bald-headed man. It only goes around once. You've got to grab it when it's there. And so I think what we have to do is go grab some of these opportunities that have been presenting themselves. When are we going to do it? We've got to do it now. The opportunity is here. It's now. And I think we've got to grab that opportunity that's presenting itself to be able to go and take up the things that Helga mentioned about finding this good committee, getting it going, and everybody has got to be involved. Not the people, just the people at the top. We've got to start at the bottom and go up and get everybody involved if we really want to make a difference.
Thank you, Dr. Alderson. I'd just like to say, clearly your husband does not have that problem of the one hair. He basically is where I seem to be going. So
I dragged him along. He brought along his little wonderful poem that he's always wanting to give. I made him sit here with me. So why don't you do it now?
Oh, we're getting preempted. Go ahead. You got something?
It's the human touch in this world that counts. It's the touch of your hand and mine that will mean more to a perishing soul than does bread, shelter, or wine. Because shelter's gone when the night is over, and bread will last only a day. but the touch of the hand and the sound of the voice will remain in the soul always. Keep doing what you're doing. You're great.
Thank you, sir. Thank you very, very much. Now we're going to break the fourth wall. Yeah, thank you. We're going to break the fourth wall and ask Diane to say something about the music question, and then we'll go to Helga.
Well, that poem actually just got at a little bit of what I would say, and there'll be much more on the panel coming after this, which I would urge people to participate in, which will feature our farmers and the question of food for the soul, classical culture. On the question of the virtual chorus, I'll just say quickly, our chorus did 2 performances on this 75th anniversary of World War II. Tri Tankista, which is a Russian military song, which we did for the anniversary of VE Day, which was seen as a generous gesture of friendship by people all over Russia. We got many, many comments. And then we just did a song from a cantata, Defend the Yellow River, which was quite a challenge for our non-Chinese speaking chorus members. And our Chinese American chorus members got quite a kick out of watching us try to learn this, especially since it was a rather quick tempo. But also that was sent, I think, as a very important gift, given all of the really vicious anti-Chinese propaganda we are hearing in the United States. And we wanted to express our appreciation for those people who helped to defeat fascism in World War II. I have two ideas on healthcare and music. One is that singing and participating in musical performance is healthy. There is a reason that Einstein was a violinist. There are even biophysical measurements of different connections in the brain that improve as a result of your engagement in classical music. And I think as part of our economic platform, my colleague Renee Segerson has proposed something like an FDR program that we establish mandatory school music programs, which I think will transform the society. And we saw that in force in a particular hospital in Harlem. And I'm not sure why it happened that way, or it is probably the case that many, many doctors and nurses are also musicians. But one of the doctors decided that these patients, you had the horrible situation under COVID that people were dying alone. And they were in their worst, most desperate need and could not draw on the strength of their loved ones and their family members. And people were taking their iPads and their phones and trying to bring people into the room electronically. So what a group of musicians did, and some of them were really very fine musicians, really semi-professional, is to have a group that played chamber music, that the other doctors could bring these concerts into the ICU and play a concert that was dedicated to the person while they were fighting this illness. And I just think that this is so important. It's very challenging to all of us to miss that human touch right now, but there are certain things that exist in the mind, which is universal, and therefore we can still reach each other, perhaps even in a more important way than the physical touch. That's what I have.
All right. Thank you. So, Helga?
Well, I just want to stress again that some people may think that there is a contradiction between trying to solve the problem at large, which is what we are trying to do with getting this international pressure really on the P5 governments, that they must take the challenge and solve these problems because they have the power to do. If anybody has it, it's the strongest governments in the world which could do it. And we must create pressure, international cause, if you want, to demand that they do it, because simply there is nobody else who can change the system in time. I think yesterday, I tried, and some other people on the panel also said, this Mr. Sief said we are 100 seconds before midnight in respect to the Third World War. I think it could be much closer, because every day, you hear new intercepts, new incidents, almost incidents. So, it's really urgent that we concentrate on getting the system changed in the large, so to speak, on the top. But there is no contradiction to that, to try to mobilize the effort, what, Dr. Elders and I were talking about since 2 months, about this committee of opposites to get the youth trained, to team up hospitals and universities in the United States and eventually in Europe with hospitals and universities in Africa, in African countries, to try to replicate this model, of teaching young people to be medical assistants. In the beginning, it will be very simple things like, teaching people how to wear masks in the right way, how to get access to these things, social distancing, all of these things. Eventually, it will become a little bit more, ambitious, and they should get really trained. And while that will not solve the big problem, I think such an effort is really crucial to show a way how in a moment like this, you have to establish this higher level, be it in the small or be it in the large. And I would really urge all the participants of the panel and those who are listening and watching it to join this, because we can only succeed if we multiply really big time in the shortest possible time. I mean, we have done quite a job since April, with having expanded into Latin America, Africa. We are trying to build up our forces in the United States and Europe. You saw by the international panelists that we have resonance in many countries, but that has to be increased and really become a chorus, which is, in a sense, and singing with such a strong voice that it can bring down buildings, it can sing down windows. I mean, if you have a laser-like voice with a chorus of the whole world, you can change the system. That's my firm belief. So I would really urge you to all help to expand this effort and listen to the next panel, because there you will hear that the farmers in the United States have the same problem like what Mrs. Nsona from Congo was describing, and that we absolutely have to hook up our forces, because I believe that the problems are such that we can only solve it if we link up with all the people who have these problems or are victimized by the present system, in order to replace it with a human one. So that's my word to you.
All right. Well, I want to thank everyone who was on this panel. There were many, many people. I'm actually not going to try to name everyone. Obviously, Dr. Elders, Dr. Evers-Manley, Dr. Kyssama-Nsona, and Helga Den Small. And we're going to be starting our next panel at 3 o'clock, which is called Building Trust in International Relations, the Role of Classical Culture and Combating World Famine. We'll see you at 3 o'clock.